The topic for today's discussion is posterior superior alveolar nerve block. The nerve anesthetized by this block includes the posterior superior alveolar nerve. The areas anesthetized by this block include pulps of the maxillary third molar, second molar, and first molar, and buccal, periodontium, and bone overlying these teeth, excluding the mesiobuccal root of the maxillary first molar. The anatomical landmarks for this block include the mucobuccal fold and its concavity, zygomatic process of the maxilla, infratemporal surface of the maxilla, anterior border and coronoid process, the ramus of the mandible, and tubulosity of the maxilla. The indications include when the treatment involves more than two maxillary molars, when supraperiosteal injection is contraindicated, as in case of acute infection, when supraperiosteal injection has proved ineffective. So these are the indications, whereas the contraindications include when the risk of hemorrhage is too great or the patient is suffering from any bleeding disorders. In this case, supraperiosteal or periodontal injection is recommended. For giving this nerve block, the patient is comfortably placed in chair and tilted so that the maxillary occlusion plane is at a degree of 45 to the floor. The operator moves to the left forefinger over the mucobuccal fold in a posterior direction or bicuspid area until the zygomatic process of the maxilla is reached. At its posterior surface, the fingertip will rest in a concavity in the mucobuccal fold. At this particular point, the left forefinger is rotated so that the fingernail is adjacent to the mucosa and its bulbous portion is still in contact with the posterior surface of the zygomatic process. Now the hand is lowered with the finger keeping the bulbous portion still in contact with the zygomatic process so that the finger is in plane at right angles to the occlusal surface of the maxillary teeth and 45-degree angle to the sagittal plane. This can be best accomplished by having the patient partially close the mouth so that the lip and the cheek can be extended laterally and posteriorly. The index finger should be pointing in the exact direction the needle is to follow. The area of insertion should be dry and painted with a suitable antiseptic solution. The previously loaded syringe is held in the pen grasp and inserted into the tissue in a line parallel to the index finger bisecting the fingernail. The insertion is made for a distance of about half to 3/4 inch going upward, inward and backward direction. You should place the needle point in immediate vicinity to the foramina through which the nerves enters the maxilla. After doing so, the 0.9 to 1.8 ml of local anesthetic solution is deposited at the required area. This is the clinical photographs depicting the procedure involving the posterior superior alveolar nerve block. In this photograph, we are depicting the position or the final position of the needle while proceeding with the posterior superior alveolar nerve block, where we can very well associate that the position of the needle or the direction of the needle is supposed to be upward, inward, and backward so that it reaches to the nearest point of the foramina where we can deposit the solution. The symptoms of the anesthesia include both subjective and objective symptoms, whereas in this block, the patient does not have any subjective symptoms. The only way to know the effectiveness of this nerve block are by instrumentation, which will demonstrate absence of pain sensation. That brings end to the topic posterior superior alveolar nerve block technique.